Today I'm going to be talking about revisional surgery. Now, many of you might be thinking about a secondary procedure, and by that I mean a second surgery. So that's likely to be that you've either had a gastric band or maybe a gastric balloon previously, and you're now thinking about having something that's a little bit more invasive, and that could be for a number of reasons. One, you didn't lose very much weight with the previous surgery, or things just didn't work out. Now, if you're thinking about a second procedure, if you're having a gastric band, if you've had a gastric band and you're thinking now about having a further procedure, the likelihood is that a gastric bypass will be recommended for you, because that is gold standard. Occasionally they do sleeves, but most of the patients that I deal with generally have a gastric bypass. Now, when you're having a secondary procedure, you really need to think about what went wrong with the previous procedure. Now, there may have been a surgical problem, so everything that I'm saying now is all based on assumption. But you really need to think about, did you work with the previous surgery correctly? Did you follow the eating techniques and the guidelines with regards to textures? Did you eat slowly enough? Did you have the band overfilled because you're expecting the adjustments to stop you eating, which then resulted in problems with the anatomy of your esophagus, which is the food pipe, and your stomach. So you really need to think about all those things, because when it comes to your secondary procedure, the gastric bypass, you will still need to make lots of adjustments to your diet, activity levels and your lifestyle. So you will need to continue to eat slowly, be mindful about the textures that you eat a healthier, balanced diet. You will need to follow all the rules. Okay, now with the gastric bypass, you are going to get that element of probably not feeling as hungry. But remember, surgery does 30% of the work, controlling physical hunger. So that's the hunger you need for survival. The other 70% is based on your relationship with food. So that could be emotional eating when you're bored, hungry, stressed, happy, for whatever reason it is. And we really do need to get down to the root cause of why you do that, to manage that. The other things are your lifestyle changes. So I look at weight loss as a holistic process. It's not about calories in and calories out. That is so old school. We need to think about your stress levels, because that will affect hormonal levels in your body, which may make you crave certain foods. We need to think about sleep patterns, nutrition, activity, but also the fun factor in life. And that's because that's what drives you, that's what keeps you focused and motivated. And we do need to think about how motivated you are, because if you're expecting the surgery to do all of the work with regards to helping you lose weight, you're going to be in for a bit of a shocker, let me tell you. So great aftercare is essential. So if you do want to find out about my aftercare, especially for those of you that have had revisional surgery, why don't you book in for a discovery call? A discovery call is all about finding out about you, your needs, and how I can support you. So why don't you just do that? So the link is in the bio in my Instagram. So get yourself booked in.